My name is Jaime Szeinuk. I am one of the doctors here in the clinic. I am associate professor of the Hofstra Medical School. The part I find most rewarding on my job is the interaction with my patients. I love the clinical work. Some deep breaths. In medicine, the doctor tells you what's your disease. In occupational medicine, the patient tells us what is the disease because the patients know more what they are exposed to. When we see a patient that is sick, it's like an alarm button went on in the work site. If this person got sick because of the job, something is wrong at the job. We see a resurgence of asthma, especially in cleaners. People who work with chlorine cleaners and spray cleaners develop much more asthma. So that's a resurgence. There's new chemicals coming all the time, and unfortunately, the process of regulation is not as strong as it should be. But the more that we can prevent occupational disease, the more we're letting people work more, be more productive, decreasing disease, decreasing costs, and that's the way people should see our specialty. We see a lot of firemen, periodic examinations for the fire companies, and we see them when they're sick. Working as a fireman exposes you to tremendous amount of toxics related to the fires. Everything that is consumed in the fires becomes airborne. It will go to your lungs, even to the masks. None of these equipments is 100%. We have a big World Trade Center population. World Trade Center was very close to us in New York, and we have a big group that is devoted to patients that were exposed to World Trade Center, and that's a whole field on its own. I think medicine is a combination of the way you treat your patients and curing their diseases, and I think both are very, very important. Our goal is to treat the patient, but then go beyond the patient to the work site and try to find out what is wrong at the work site to prevent diseases in other workers. It's very difficult in real life because, there's a lot of barriers starting from the employer side, and it's very hard to overcome those barriers. Practicing this specialty is a lot of medical work, a lot of legal work, and the system is a very difficult system to traverse. So there's a lot of coaching that you have to do for your patients, a lot of support. And really what I like from my work is doing that. The support that we provide to these patients. I think that the one thing that differentiates this clinic from many other clinics is precisely that. I think we do it superbly well.